Georgia and Alabama here in another SEC championship game. It's goal to go for the Crimson Tide.
The fourth offensive play, our fourth offensive play, he suffered a high ankle sprain.
Tua limping has gone to the medical tent on the sidelines.
And perform what they call a tightrope procedure on Tagovailoa's ankle.
By doing this procedure, we can improve your long-term outcome and function.
We'll get them walking day 4, day 5 after surgery, running day 8, day 9, and cutting as soon as they can after that.
My name is Nicholas Olson, and I'm here today with Alexander Dowd and Heather Lewis. And together we'll be taking a fresh look at high ankle sprains and give you a little insight into our design into renovating the treatment of syndesmosis injury with concomitant fibular fracture.
High ankle sprains are a common injury, specifically amongst collegiate athletes participating in contact sports. This includes the partial or complete tearing of ligaments that make up the disto-tibiofibular syndesmosis, resulting in instability.
There are over 2 million ankle sprains treated in the emergency department each year, 10% of which are high ankle sprains, which are a much more severe injury that require much more invasive treatment procedures and require a longer time to fully recover. The most common mode of injury is when the lower extremity has an external rotation while the foot is dorsiflexed, and this can be seen in the images of these athletes.
In some cases, the fibula may fracture at the lateral malleolus or in the diaphysis of the fibula, which is the focus of this project. The current market uses screws and plates to attempt to fixate the tibia, fibula, and talus.
MyTech of Deploy Synthes, a company of Johnson & Johnson, does not currently have a product on the market that treats this injury. As a result, competitor products are dominating this niche of the sports medicine device market. It was our ultimate goal to generate a final design that has the potential and capability to make it to market.
Our design focuses on the development of a single-use, disposable, sterile surgical kit that allows for the non-rigid fixation and stabilization of the distal tibiofibular syndesmosis following a high ankle sprain. The kit allows for an increased ease of use for the physician, an increased average revenue per case, and allows for rapid, adequate surgical training. The biomechanics of the distal tibiofibular syndesmosis were investigated, as well as the current products on the market, to develop a novel design for Deploy Synthes, part of the Johnson & Johnson Medical Device Company.
We have designed a C-shaped plate which will attach to the existing 1/3 tubular bone plate. The reason for this is so that there will be no reason to drill a channel through an already fractured fibula. By avoiding drilling through the weakened bone, we are hoping to reduce the recovery period and optimize the post-op bone quality of the fibula. The C-plate will screw into the plate as normal, but the extension will wrap around the fibula. On either side of the extension, there are 2 holes, which is where a suture will be attached and threaded through channels drilled in the tibia and connecting to 2 cortical buttons.
Current data has been obtained through studying published literature. However, additional testing and results will be obtained on a variety of novel cortical button technologies, as well as the strength of the sutures and tension. We expect the suture strength to be sufficient to withstand the loads on the ankle joint.
Data from a study comparing the single, parallel, and divergent suture orientations under cyclic testing revealed that there are no significant differences in the strength of the suture system in each of the 3 orientations. Future testing will be conducted on the 3 suture orientations, analyzing the ability to oppose posterior displacement, as it was found that the fibula tends to displace posteriorly when this injury occurs. We expect the divergent orientation to be the strongest orientation to prevent posterior displacement. Furthermore, by orienting the sutures divergently, they will run parallel with the AITFL, the most commonly injured ligament in a high ankle sprain. It is believed that this orientation will reduce the healing time of the AITFL by providing mechanical support for the healing ligament. We are looking to confirm this with future testing.
Future testing of the 3D printed prototypes, as well as further analysis of the biomechanics of the high ankle joint, will be conducted to determine a single optimal design that can be taken to market by Deploy Synthes. In the future, testing on a force platform through IRB protocol will be done to analyze forces in the ankle joint post-surgery. Final prototypes would ideally be tested in the cadaver lab. We are continuing this project by filing new cortical button designs for intellectual property.